Is Your Liver Healthy with the Global Liver Institute. I'm your host, Jeff McIntyre, and Vice President at GLI. Now, if you are joining us for the first time, this is a show for conversations around the big and the little questions around liver health. Now, that may sound a little niche to some, but those that work in the field know that liver health is a gateway to so many other issues we face as patients, as caregivers, and, well, frankly, as a society. Whether you're trying to figure out the best thing to fix for dinner, how to talk to your doctor, or what the latest in diagnostics or treatments are, we are here to learn from each other over the course of this monthly program. Now, last month, Global Liver introduced the latest edition of our Global State of Liver Health Report. And this is a great reference that gives us a chance to see what the extent of liver health issues are worldwide. We go nation by nation, eventually building a worldwide collection of where we stand on global liver health. Now, for instance, you'll see that one country had better success dealing with hepatitis, that's Egypt, while others are struggling with the rise in metabolic health concerns, and unfortunately that's almost everywhere. So how do we deal with this? How do we come up with solutions in proportion to the seriousness of the problems that we face? Now, for this episode, I had the honor to speak with liver health leaders from around the world about their greatest challenges and what we can learn from each other to overcome those challenges. Let's get started. For joining us. All right, it's always great to be joined by two of the leaders in the liver field here, Dr. Dysfunction from Saudi Arabia and hepatologist practitioner, EASL Secretary General, and Renaissance Mountain Man Alexander Krau from Denmark. Let me pause there before I've said too much about each of you. Dr. Dysfunction, if you would say a little bit about your background and about what brings you here today.
Okay. Thank you for having me with you today. I am Dr. Mahmoud Dysfunction. I am a consultant gastroenterologist, and as well as I am assistant professor in the Faculty of Medicine. Through my career, I was working in the field of clinical services and medical education, and I have deeply involved in the advancing liver health, particularly in the era of hepatitis C in Egypt and tackling hepatitis C. Early in 2015, I launched the Egyptian Hepatitis Alliance, which is an initiative aimed to increase awareness, expanding screening program, and improving access to the new antiviral medication. Also, I lead an awareness campaign and organized many free medical convoy to the area of poor population and poor patient, and help to educate community and support early detection of the disease. My focus on addressing liver disease, including also this rising instance, and I can see it as a tsunami of MAFLD and MASH, and I am passionate about promoting the education, screening, and the treat approach. Even I called it ES&T approach, for better liver health, and I am happy to be with you today.
Excellent, thank you. No stranger to Global Liver Institute and a friend of the organization, Alexander Krau. You would say a few words about what brings you here today. It's good to see you.
Yeah, good to see you too, Jeff. Thank you very much for inviting. Happy to support GLI on this journey here. I'm Alexander Krau, clinical hepatologist, professor of hepatology, and heading the research center here in Poland. I've been active in research clinics, but also serving as EASL Secretary General and working there with our global partners. So thank you for inviting me.
Absolutely. Let's stay with you on this. So this is the release of GLI's Liver Health as Public Health Report. It's trying to kind of wrap our heads around what countries do well, what the challenges are they face. It's a little bit of population data, trying to just kind of get a better idea of the state of liver health. And so I'm wondering, Alexander, if you can talk to us a little bit about Denmark, about kind of the European region that you've been involved with as EASL Secretary General as well. what are the challenges to liver health that you find that kind of rise to the top of the priority list right now?
Yeah, so I'm privileged to be part of, I think, maybe a small country, but one of the richest countries in the world. And therefore, it actually saddens me a little bit to see that some of the things we could do better. I think we've done great with Hep C when it all came through. A lot of case finding, a lot of treatment, wonderful. But where we are lacking behind is actually some of the behavior-related diseases associated with obesity, alcohol. In Denmark, almost 10% of the population engage in harmful alcohol consumption. We have 20% have a BMI above 30, and that combination is harmful. And there we see an increase actually in the burden. And I'm then a little ashamed to see that the societal response in terms of actually working against this, with making some restriction, minimum unit prices for alcohol, restrictions for marketing, some of the things that we know works is actually not happening, and that's an issue. And again, looking at the European landscape, you can see all the alcohol-producing countries behave more or less the same. That you don't really do much to reduce alcohol-related harm, and these days alcohol is responsible for 800,000 deaths in Europe a year. Not all liver, but so it is an issue, and we need to focus, and I think need to communicate stronger around that, because these diseases, or this part of the liver spectrum, is 100% preventable if we want.
So that's okay. I don't want to stereotype, but when we think of the Gulf region, issues with alcohol tend not to rise to the top of most people's thoughts in terms of liver health. What are the challenges that you're facing there in Saudi Arabia and Egypt and kind of other throughout the Gulf region in terms of promoting better liver health?
Let me tell you from my past experience in Egypt and about liver health in general. There's something was very important is education. The problem with liver disease is science is silent, and it is not, there is a lack of science of liver disease. Even with hepatitis C, we didn't show the patient unless they have cirrhosis or have complication, and this was the greatest problem we faced. Even when I started my campaign, I put the priority is to educate. And education was not directed only for the patient or for the community, but also for the primary care physician. I was very dedicated in teaching the student and the intern and the medical resident how can they examine the patient and find any early sign of liver disease. Because if they are not educated well about the sign and the method of diagnosis, it will be missed from them. So I think is a lag area or the weak area for liver disease in general and for MAFLD or hepatitis C was education. We have to educate the community. We have to educate the primary care physician who see a lot of patients, who sees a large number of patients. So education is the first priority. And even I started this approach, which is ES&T, educate, and then screen, and then you can treat. So when you educate the patient, the community, they will become aware, and you don't know how it was very effective in the era of hepatitis C. Mm-hmm. Educating the patients that is there is a science, there is a treatment now available. It was very important. Now, because the patient was first, they know that the medication only was interferon and ribavirin, and it was disappointing for many of them because the success rate is, as Dr. Alexander can agree with me, it is not all, it is only from 50 to 65%. And this was very not available or not accessible for many patients. And the other idea, it is not successful for many patients. So I think in not only in MENA area, the North African or Gulf area, but also it is globally. The education is important and the awareness of the disease and the disease process is important. For muscle and MASH, it is important to screen the high-risk population, who is the patient with obesity, diabetes, and metabolic syndrome.
I think, I want to look at this from the other side of the equation on this. So often, it's justifiable. We get caught up in the magnitude of the problem, in the, as you said, the tsunami that faces us. We all see this coming, whether it's looking at actual prevalence numbers or projected prevalence from the rise in other chronic diseases that we see. Dr. Crown, I want to go back to you and flip this on its head from what we usually talk about. What do you think in Denmark or in Europe, what do we do well? What do you think is something that is exemplary? What's a good approach to this and a good program that we should be talking more about?
So I think one thing we can learn from Europe, where we have the advantage that most countries are driven by public health systems, which means that it's free, it's accessible for all. And we know with exactly these diseases, it's also Hep C, Hep B, that is also very much associated with migrant health. We need to see, but also obesity, alcohol is also have stigmatized nature and socioeconomic issues. So there, I think we have an opportunity actually to reach out to the more marginalized, vulnerable population that was otherwise not reached out to. And we give some of the example of countries that has actually done well. If you look at what happened in Scotland and Ireland also, well, they put minimum unit pricing in. And it's interesting to see that you can then reduce the alcohol consumption overnight by just changing the price. And that translates directly into less alcohol-related harm, particularly among the young. Many people don't know that the most important risk for death among the young are actually alcohol-related, not because they get liver disease, but because they get accident. But in the long run, they get liver disease. Because that's some of the things what we can do. And I think we can, to my knowledge, there's not yet anybody who actually implemented tax on sugar sweetened or marketing towards kids. We should protect our kids against these because, at least 10% of the kids have steatotic liver disease. That's not okay. We can do better. So why don't we work with school food, with improving or forbidding marketing towards kids to protect them? Because they will, we see sometimes kids in early 20s needing a liver transplant for something we could have prevented.
You're speaking to my heart. I spent the first part of my career specifically working on food marketing towards children, and we see so many places where even things like front of package labeling work so well. This is great stuff. Dr. Desica, I'm wondering, we mentioned earlier the Egyptian work around hepatitis. In this area of liver health, what do you feel like's done well? What's something that we could learn from the Gulf region or the MENA region?
What we did well, because it was a very profound problem in Egypt, and there is a driving force for all of us, the physician, the health advocate, because we see how much the patient is suffering. So it a comprehensive and collaborative work from all community members, not only physicians. Okay, but I learned a lot about when you incorporate, and even I was telling everyone, this is your responsibility, and you have to act. You have to be part of this campaign. You have to be part of this regulation. What happens? There is many small models of hepatitis C treatment was through all Egypt, and then it becomes a national campaign or a national direction for the treatment of hepatitis C in Egypt. Is called Saving a Million Life, and that is what collect all this effort and help us to get rid of hepatitis C. The problem with other liver disease is, as Dr. Alexander said, it is our health, our lifestyle, and people habits. Now, you're trying to push people to go a health lifestyle, which is not easy. And if they are not educated well, they will not follow what we are telling them.
So one last question here. I want to do a little round robin with both of you for the questions. Alexander, we'll go back to you for this. Is in 2024, Global Liver Institute celebrated our 10th anniversary. And I think you were there at one of our celebrations at the EASL meeting. We appreciate you coming by. 10 years from now, in 2034, or if we think about that, 2034, what do you think the victories are that we're going to be celebrating in liver health? And what are going to be the challenges then? But I want to emphasize, what are the victories? What gives you hope? What are we going to be look forward to? What are the victories we're going to be talking about in 2034?
I'm always very optimistic, very positive, and I think there's good reason to be that. If you look at the steatotic liver disease spectrum, alcohol, cardiometabolic risk factors, and the mix, we're at the brink of a transformative change, that's for sure. Because now we got the first two drugs with positive phase 3 trials, and we got a ton of new drugs. So in 10 years, we will have on the shelf, when people come to my clinic, I'll have several options. Some drugs will work for some will not tolerate, but I have a lot of things to do. That's only part of it. That's a very important message. We cannot treat us out of this, but this will bring a lot of activities in. That would also mean that we can work with awareness. We can work with health literacy. Many people have not much information to understand what the liver do or not do, and how do you actually take good care of your liver. So I think with that we can drive the change for both the policy, for prevention, and integrated liver health. These drugs are not just alone, it should be together with physical activity and diet changes. And I'm particularly also worried about the next generation, the protection about the kids. And I'm sure if we all go together, we can make policy change and actually have ban against marketing unhealthy food towards kids, and hopefully break the obesity epidemics among kids. And we don't need all kids from their 10-year-old to be in a drug for the rest of their lives. This is not the direction to go. So that's my vision. Of course, then new issues will pop up, but let's see. I think we now got several tools, and we actually know what to do. We know how to do it. Now it's just about that we all focus on it and get it done and stand together.
Excellent, Dr. Dysfunction. 10 years from now, it's a little hard to imagine. 10 years seem to have gone so fast, the past 10 years. But 10 years from now, what do you see the victories that we are celebrating in the Gulf region when it comes to liver health, and what are the challenges 10 years from now?
You remind me with when we was in 2010, and we was trapped in this increased number of hepatitis C patients and liver cirrhosis, hepatocellular carcinoma complication. We was living the story from the start of discovering that the patient is having hepatitis infection until we see the morbidity and the mortality. And we didn't, we was not able to imagine we will have a victory in 2013 when the first direct antiviral medication, Sofosbuvir, came out. But I will keep regarding the current challenges we are facing in the treatment of MAFLD, and in spite of this increasing incidence of obesity, metabolic disease. But as Dr. Alexander said, that we have tools, and we have many options for treatment of obesity and metabolic diseases. So I think there will be another victory for human against the disease in the next 10 years. I think it's awareness and the new medication for obesity and the rising of new medication for steatosis. This increase, or this can break the circle of the disease. And we can, as you said, we can inshallah come after 10 years and said we are victory and we have another victory of humanity against the disease.
All right, Dr. Mohamed Dysfunction, Dr. Alexander Krak, thank you so much for joining us today. We really appreciate your insight and your continued partnership with Global Liver and your leadership in each of your areas, certainly. Wow, that was a lot, and that was really great. It's really so, cool to be able to have the technology these days to bring in all these amazing, players and the amazing leaders in liver health worldwide. Granted, we had a couple of connection issues with our friends from Nigeria, but I think that's kind of exemplary of what we're dealing with in liver health generally, isn't it? That we're trying to make the connections, trying to get less compartmentalized as well, where you can kind of see the differences, but also see the commonalities that we have in dealing with these issues. Lily, you've been worldwide, and you've been at the heart of this project for a couple of years now. What are your thoughts?
Yeah, I think that some of the challenges are kind of parallel to the challenges that we're seeing as we're interviewing and talking to people from different countries. We're facing a lot of the same issues, but the resources that each community has, that each country has, are so different. So I think it's helpful. It's helpful to see kind of what best practices are, but then to have those conversations to figure out how they might fit back into each community.
Yeah, I really like that. I mean, I think we often get caught in this mentality of, because so many countries follow the lead of the Food and Drug Administration here in the U.S. for approvals and clinical trials and all that sort of stuff. There's this almost kind of false notion that there's a trickle down, if you will, is that that the West is here to help, and we see, especially in Egypt and how they approached hepatitis, that we have a lot to learn from these countries. And so as we can get better data, better examples, as is in the report that we have coming out, or that has already come out, how we can better address and truly learn from each other. Sugar sweetened beverages are an issue almost everywhere. We see metabolic syndrome really rising worldwide. We are in this together, and I think it really, really speaks to our need to learn from each other and work with each other that much more so.
Yeah, I mean, the science is pretty much the same no matter where you go, but the details and the epidemiological data is different. So there's definitely a gap in on that side.
All right, we'll be back next month to focus on rural areas and rare liver diseases as part of GLI's Rare Liver Diseases Month. Lily, did you know that a disease is only considered rare if it affects only less than 200,000 people?
In what population?
Well, in
the world or in the country?
In the country.
Okay.
So
I didn't know that.
Almost 250,000 of people can have a condition and it still be considered rare, which means it's likely under-resourced and undertreated in that. And so if you overlap that with the many issues around rural healthcare, and I'm really looking forward to learning more when this episode drops in February. Now, for more information about liver health and to find a copy of the Global State of Liver Health Report, find us at globalliver.org. And be sure to join the conversation at our socials on Facebook, Instagram, and LinkedIn. You'll see the video version of this on YouTube, but we're also available on the latest podcast platforms, Spotify, Apple Pod, Pandora, or, wherever you're listening. Now, depending on how you found us, make sure to leave a comment, like, and subscribe so you don't miss any of the upcoming episodes and the great conversations ahead. A thumbs up may not seem like much, but it helps us grow awareness, education, and build support for liver patients worldwide. I'm Jeff McIntyre, and on behalf of producer extraordinaire Lily Bainick and the team at Global Liver Institute, we'll see you next time.